right, 25 minutes before 11 o'clock. Thank you for tuning in. Every morning we speak to Galen Unold from Life South Blood Centers, and so many times blood donations go to people who actually have a blood disease. I don't know the science behind it, and that's about all I can tell you. I just know that our role as blood donors helps out a lot. Dr. Ivy Altomare is on the phone. Dr. Altomare is a medical oncologist specializing in hematology at Duke Cancer Network. She's an associate professor of medicine at Duke University School of Medicine and works with thrombocytopenia patients, ITP for short, and helps manage their symptoms. She's on the phone to talk to us about that. ITP, which I'm not going to try to say it again. It is considered a rare and potentially serious blood disorder. September is National ITP Awareness Month. Good morning, Dr. Ivy Altomare, and I apologize if I'm mispronouncing your name. Good morning.
No, your pronunciation is perfect on both accounts, both my name and thrombocytopenia. You said it like a true hematologist.
Except I had to do it slowly. I was like a child reading from a new book, right?
Well, and thanks so much for your work promoting blood drives. You know, that is so important, and it really, really, really makes a difference. So many times people need a critical transfusion, and if you don't have blood in the bank, it's a big deal. So thanks for doing that.
And is that the case with people with ITP? Do blood transfusions help them survive, I guess, is the best way to ask?
So it's actually really interesting. So ITP stands for immune thrombocytopenia, as you said. It's an autoimmune disease where the body destroys platelets, and that's why the platelet count is low.
Oh my gosh!
So these patients have bleeding from low platelets. If you give them a platelet transfusion, those platelets will get destroyed immediately.
Wow.
So platelet transfusions don't actually work for these patients. We have to fight the disease in a different kind of way.
Oh my gosh. Well, would whole blood help, and the body would do what it needs to with the platelets that it gets?
If you give whole blood, the platelets in that whole blood will get destroyed immediately.
Oh my gosh.
So it just doesn't work. So patients with this disease, their platelets are low because their body is destroying them. And what we have to do is we have to either stop that destruction or stimulate the bone marrow to make more platelets.
And is it a type of cancer?
It is not a type of cancer. So we call it a blood disorder. It's a chronic autoimmune disease, and it's managed by hematologists. Okay. We are blood doctors, and hematologists do everything from blood clots and sickle cell anemia to blood cancers. This is not a blood cancer, but it is important if someone has ITP to see a hematologist.
What does it look like, and how old are the patients?
Yeah. So the hallmark of the disease is low platelets, and that can be picked up on a regular blood count. A routine blood test that we usually get as part of a regular checkup is a CBC, and platelets are on there. So if a platelet count is low, there's many reasons why that could be, and that will usually trigger a referral to a specialist. Patients might not have any symptoms of bleeding, but if they do have bleeding, it's usually frequent bruising and things like nosebleeds or bleeding when you brush your teeth. Now, that can be normal and really not a problem at all, but it could be a symptom of this disease.
So would a general physician know to look for this when they're giving their patient a physical?
I really do believe so. A regular blood count, the platelets are on there, and if a normal platelet count is between 130 and like 400. So if the platelets are low, 100, 90, 60, usually patients will be referred to a specialist even in the absence of bleeding. Okay. But then the other way that patients can get checked out is they say, I've noticed I'm getting a lot of nosebleeds. You had asked Larry earlier, when does it present? Usually in people's like 40s, 50s, 60s is when we see this pop up.
Are they experiencing like tiredness or what's the other one when you just feel
lethargic?
Lethargic, that's a good word. Yeah, are they experiencing that?
Absolutely. So we don't know why, but many patients, when their platelet counts are low, they will feel extremely tired. And so that's usually not a presenting symptom, But once patients are diagnosed, it's something that affects them throughout their lifetime.
When people are on Coumadin and they, hit the wall or something with their arm or the back of a chair, their skin usually breaks and can cause bleeding. Can this be associated with ITP?
Yeah. So frequent bruises that happen out of the blue can sometimes alert us that this is going on. When patients have this, we try, the goal is to really reduce the risk of bleeding and try to get the platelet count in a good range. Sometimes patients have to be on aspirin for their heart, and then we're kind of managing.
Oh, yeah.
So we want to protect them against blood clots, but we don't want them to bleed. And so, again, it's the specialist's job to really, kind of navigate this for the patients.
Do the more fragile parts of our body, I guess, are they affected first? I guess like the capillary, what is it, capillaries? The tiny little blood vessels in our eyes and our brain, are they, like, could we have a stroke, I guess, or could we go blind from this as a side effect?
Yes, and yes, and yes. So, Larry, I think you should go to medical school.
There you go. There you go.
You're very thoughtful about
this.
this.
Natural.
No, I mean, you're absolutely right. So capillaries can burst, and those can cause little things we call petechiae, which are like little red dots on your skin. So, fortunately, most often, if people have this, their platelets are low but not dangerously low. So that is a good thing. And then we treat patients to try and keep their platelets in normal range, but very rarely the platelets can drop to very low levels, and that's when you can get a stroke. And it can happen out of the blue, and without warning and without an injury. It could just happen spontaneously.
And can this affect anyone? I mean, male or female, or does it target one sex over the other?
We do see it slightly more often in women than men, similar to, I think, other autoimmune diseases, but I mean, it's only slightly more often in women. So it's generally, both genders.
I'm guessing it's managed but never cured, is that right?
So, yeah, the majority of patients will have the chronic form. Rarely we do see this kind of go away on its own, and we just call that acute ITP. That's rare, but it can happen. And we don't. It's unclear how often it goes away. Maybe 10% of patients it'll go away after the first treatment. But most of the time, this is something that people are going to live with for their whole life. And it can really take its emotional toll because walking on eggshells, worried about bleeding all the time.
I can hear what you're saying. Oh, so the person who we are scaring right now, maybe we've hit on some symptoms that they or a loved one is going through. Is there a direction we can send them? What do you suggest? Is there a website or a doctor or both?
Yeah, so I would say always good to bring up any concerns with your doctor about anything at all. For ITP and bleeding things, there are a couple of great websites. So the Platelet Disorder Support Association is a nonprofit organization, and they have been around for a long time, do fantastic work. Their website is pdsa.org. And then there's another one specifically for ITP sponsored by Novartis called myitplife.com. They have patient stories and resources and great places to go if you have more questions.
Wow.
Nice.
Well, if we have piqued your attention because it sounds like something you're experiencing or somebody you love is experiencing, please see the doctor and check out all the resources. It's the good news is that you guys have figured out a way to at least help us, have as normal a life as possible. That's the good news. One of these days, there's going to be better news. You're going to come on, Dr. Altomare, and you're going to say, guess what? We cured cancer. And we cured this. We cured this, too, ITP. Thank you so much
Hope so.
Thank you so much for what you have chosen to do with your life and for taking some time to be on the air with us with what we've chosen to do with our lives.
Well, you're both very good at your jobs, and thank you so much for having me. It was an honor.
Oh, that was sweet of you to say. Thank you so much, Doctor. We will be right back.
Did you call Mike Scott Plumbing about the irrigation? No, but did you know a crocodile can't stick its tongue out? Or that Humpty Dumpty rhyme never actually says he's an egg? Or that Chuck Norris counted to infinity twice?
Where the hell do you come up with these facts? And what's that have to do with the lawn?
Nothing really, just hoping you'd forget what you told me to do.
Well, here's a fact. Just like an elephant, I